Welcome back, deep divers. Today we're going deep on something you might not think about every day.
Yeah.
Complications from abdominal surgery.
Right.
You sent over this fascinating medical chapter on the topic, and wow.
Most surgeries, thankfully, go smoothly.
Right.
But knowing what could happen is important.
Yeah.
Think of this deep dive as like your guide to potential issues.
Okay.
Why they matter and how they're tackled.
Okay, so let's get into it.
Let's do it.
Let's start with something kind of creepy, hematomas and seromas.
Okay.
So picture this. You've had abdominal surgery. You're all stitched up.
Right.
And then, like, hidden lakes start forming under your skin.
Definitely not the kind of lake you want to swim in.
No.
But it's more than just the ick factor, right?
Yeah.
These pockets of fluid blood for a hematoma,
Right.
serum for seroma, they can become like breeding grounds for bacteria. A warm, moist environment under the skin.
Oh, yeah.
It's like a bacteria's dream vacation spot. And that's why surgeons are so careful about controlling bleeding during procedures.
So they're not just being perfectionists when they're, like, meticulously cauterizing every little bleeder.
Exactly.
They're trying to keep you from developing these bacterial party zones under your skin.
That's a great way to put it.
But what happens if a hematoma or seroma does form?
Well, then it's time for some drainage action.
Okay.
Sometimes you can just drain it with a needle, pretty straightforward.
Okay.
But other times it might require packing the wound
Oh, wow.
with gauze to help the area heal and prevent infection.
Okay, that doesn't sound fun.
Not particularly, no.
All right, so next up we have surgical site infections, or SSIs.
Yep,
We've all heard of infections after surgery,
of course.
but the CDC actually has specific classifications for SSIs.
Right.
So they're not just minor scrapes. We're talking about serious stuff.
Absolutely. And there's a whole list of risk factors.
Oh, yeah, like what?
Diabetes, smoking, even obesity.
Obesity.
Wow. It all plays a role.
It's like a whodunit for your surgery.
Yeah, you could say that.
The source material mentions things like chronic lung disease and anemia as risk factors.
Interesting.
So many things can increase your risk, it seems like.
It's true.
So if you're planning abdominal surgery, talk to your doctor about your specific risks.
Absolutely have that conversation.
Okay, so let's say an SSI does happen. How is it treated?
Well, treatment can be pretty intense.
Oh, no.
Imagine this. They have to go back and reopen the incision, drain the infection, clean everything out.
Like a whole mini surgery.
Exactly. And then there's the antibiotic situation.
Yeah, antibiotics are the big guns, right?
They can be.
But it's not always easy to find the right one, is it?
Not always think of a wound culture like a petri dish.
Okay.
A mix of different bacteria, finding the right antibiotic to target all the culprits can be tricky.
Yeah.
Like trying to hit a moving target.
And then to make things even more complex, sometimes surgeons use delayed wound closure.
Right.
So instead of stitching everything up immediately, they leave the wound open for a few days.
Right, to allow for drainage.
To allow for drainage, and then close it later
Exactly.
when the risk of infection is lower.
It's a delicate balance.
It's a balancing act.
Between healing and minimizing reinfection risk.
Now, speaking of wounds coming undone, let's talk about something called fascial dehiscence.
Okay.
This is basically when your incision starts to separate.
Yeah.
And not just a little separation. We're talking partial, or part of it comes apart.
Huh?
Or where the whole thing opens up.
That's a serious situation.
Cue the dramatic music.
Definitely a situation you want to avoid.
Why is it so serious?
Well, for one thing, complete fascial dehiscence can lead to evisceration.
What?
Meaning your internal organs could start pushing out through the opening.
Oh my gosh.
It's a medical emergency.
Wow.
Even if it's not, that extreme dehiscence can increase your risk of developing an incisional hernia later on.
Okay.
That's why following post-op instructions is so crucial.
Yeah.
They're there to help you heal and avoid those complications.
So many things contribute to fascial dehiscence, like infection and obesity.
Right, those are some of the big ones.
But did you know things like chronic lung disease and anemia can also play a role?
Oh, that's interesting.
Yeah, it's not just about the surgery itself.
Right.
It's about your overall health and how well your body can recover.
Exactly. And speaking of factors that influence healing, let's talk about the surgical techniques themselves.
Okay.
How those incisions are closed up.
Yeah, it's more than just slapping on a Band-Aid, right?
Way more. Think of it like this. The way the incision is made, the type of sutures used, the spacing between stitches.
Oh, wow.
It all matters.
Like what?
Well, for example, continuous sutures are often preferred,
Continuous sutures.
where the suture runs in one long line.
Okay.
It helps distribute tension evenly along the incision.
So less strain on individual points.
Exactly.
Like choosing the right thread for a sewing project.
Exactly. You wouldn't use delicate silk thread for a heavy-duty backpack.
Right.
You want something strong and durable.
Exactly.
And then you have retention sutures. Those are like the heavy-duty reinforcements. Placed further away from the incision line, and they go through all layers of the abdominal wall to provide extra support.
So they're like the extra strong thread.
Exactly.
Okay, before we go too deep into the suture world, let's talk about nerve injuries.
Okay.
You might not think about it, but surgery can actually lead to nerve problems.
That's right. There are nerves everywhere, and sometimes they can be affected during surgery.
How?
Well, it can happen in a few ways. The nerve could be cut. That's called transection. Or it could get trapped by surrounding tissue. That's called entrapment. Or it could be compressed.
Compressed.
Pinched, basically. And all of those can cause pain, numbness, weakness.
Yeah, all sorts of unpleasantness.
Definitely.
I know the source material goes into specifics about nerve injuries with different abdominal surgeries, but we'll save those for another deep dive.
Good idea.
Okay, so let's move on to a couple of special situations
Okay.
that can complicate abdominal surgeries, morbid obesity, and radiation. So first up, obesity. I think we can all imagine how extra weight could make surgery trickier.
Of course.
But what are the specifics?
Well, one major challenge is the panniculus.
The panniculus.
That's that apron of fatty tissue that hangs down from the abdomen.
Oh.
It makes it hard to see and access the surgical site.
So not only is it physically harder to operate,
Yeah.
but it also increases the risk of things like infection and fascial dehiscence.
Exactly. And that's why surgeons might recommend a panniculectomy.
Panniculectomy.
It involves removing the panniculus altogether.
So clearing the path for the surgery.
Exactly.
Okay, and then we have radiation. It can treat cancer.
It can.
But what happens when surgery is needed in an area that's been irradiated?
That's when things get tricky.
How so?
Radiation can weaken tissues, make them more susceptible to injury and infection.
Oh, wow.
It's like a window of vulnerability.
A window of vulnerability.
Meaning the timing of surgery in relation to radiation is crucial.
So ideally, surgery would happen before radiation begins? That's right.
But I know that's not always possible.
No, it's not.
So what if it needs to happen after radiation?
Then it's important to allow the tissues to recover.
For how long?
For several weeks after the radiation is complete.
Several weeks.
Before going in with the scalpel.
Yeah.
Rushing things could increase the risk of complications.
Okay, so it's like this delicate balancing act. It's figuring out the best timing.
Precisely. And that's why surgeons are the experts, right?
Yeah.
They have to weigh all these factors and figure out the safest approach for each patient.
Okay, so they're like playing 4D chess.
You could say that.
Trying to anticipate every move and every possible outcome.
And that's why a multidisciplinary approach is so important.
Multidisciplinary.
The surgeon isn't making decisions in a vacuum.
Right.
They work with oncologists, radiation therapists, all sorts of specialists.
So it's like a team of superheroes.
I like that.
Each with their own unique powers.
Right.
Coming together to fight for the patient's well-being.
That's a great analogy. And speaking of teamwork,
yes.
Let's go back to something we touched on earlier. Pain management after surgery.
Okay.
I mean, no one enjoys pain.
Absolutely not.
Especially after going through something as major as abdominal surgery.
Of course not.
So how do doctors handle this post-op pain?
Well, thankfully, it's much more sophisticated now than it used to be.
What do you mean?
These days, we use a multimodal approach to pain management.
Multimodal.
It means combining different techniques to target pain from multiple angles.
So like a pain-fighting cocktail?
Precisely.
Okay, what are the ingredients in this cocktail?
Well, it might include medications like opioids, NSAIDs, or even nerve blocks.
Nerve blocks?
Which deliver medication directly to the nerves that transmit pain signals.
Wow, that sounds intense.
They can be very effective for severe pain.
Oh.
And then you have non-medication options like physical therapy to help restore movement, and even alternative therapies like acupuncture or massage.
Wow, so many options.
We want to address pain from every angle.
So it's not just about masking the pain.
No.
It's about getting to the root of it.
Exactly, and helping the body heal properly.
Okay, and let's not forget about good old-fashioned nutrition.
Oh, absolutely.
What we eat plays a huge role in how we recover from surgery.
It's like fueling a car for a long road trip.
Okay.
You wouldn't put cheap gas in a high-performance vehicle.
Right.
Your body needs the right fuel to heal properly.
So what kind of fuel does the body need after abdominal surgery?
Well, the source material doesn't go into specifics about a post-surgery diet,
Okay.
but it does emphasize the importance of protein.
Protein.
It's crucial for building and repairing tissues.
Okay.
So make sure you're getting enough through your diet or even supplements.
So load up on protein, got it. But what about patients who can't eat after surgery?
Right, that's a common problem.
Yeah.
Nausea, pain, other complications.
I'll make it hard to eat.
In those cases, nutritional supplements or even intravenous feeding might be necessary.
Intravenous feeding.
Yeah, it's not ideal, but it ensures the patient is getting the calories and nutrients they need to heal.
So it's like a walk around, a detour on the road to recovery.
Exactly.
To make sure the body gets what it needs.
Precisely.
Yeah.
And speaking of finding workarounds,
Yeah.
let's go back to the challenges of operating on patients with morbid obesity.
Okay.
We talked about paniculectomy.
Uh-huh.
But the source material mentions other techniques to improve access and reduce complications.
Like what?
Well, one technique is to use specialized retractors.
Specialized retractors.
Kind of like surgical clamps.
Oh, okay.
They lift and hold the paniculus out of the way during the procedure.
It's like parting the curtains to let the light in.
Exactly.
And then the surgeon can see better.
Exactly. It's about creating the best possible working conditions.
Even when faced with challenging anatomy.
Right. And it highlights the importance of choosing a surgeon with experience in these types of cases.
It's like choosing a specialist for any other complex task.
Exactly. You want someone who's been there and done that.
Right.
And speaking of specialists, yes.
Let's talk more about radiation.
Okay.
It can have a big impact on abdominal surgery.
I know we talked about how it can weaken tissues and make them more prone to injury.
Exactly. And one of the key takeaways from the source material is the importance of timing.
Timing.
Ideally, surgery would be done before radiation.
Okay.
Or, if that's not possible, it should be delayed for several weeks after.
So let the tissues recover.
Exactly.
Okay.
So it's a delicate dance between treating the cancer and minimizing the impact on surgical outcomes.
And that's where those multidisciplinary teams are so important.
Absolutely.
They can come up with the safest and most effective plan for each patient.
Exactly. It's all about collaboration.
Yeah, working together.
And shared decision-making.
Making sure the patient's needs are at the center of it all.
Exactly. And speaking of patient needs,
yes,
I'm curious about something the source material mentioned.
Okay.
Pain in irradiated wounds.
Right.
You'd think pain would be a given.
But the source suggests it might be more than just post-surgical discomfort.
Okay.
It mentions that pain in irradiated wounds could be a sign of ischemia.
Ischemia. What's that?
Ischemia is restricted blood flow.
Restricted blood flow.
So the pain might be a signal that the tissues aren't getting enough oxygen and nutrients.
Because the radiation damaged the blood vessels.
Exactly.
Wow, that's fascinating.
It is.
It's like our bodies are sending us these messages.
Yes.
We just need to learn how to understand them.
And speaking of understanding messages, let's go back to surgical site infections for a moment.
Okay.
The source material goes into some detail about the different antibiotics used to treat them.
Oh, yeah. Antibiotics.
That's a whole world of pharmacology.
So what are the key things to know?
Well, first of all, not all wound infections need antibiotics.
Really?
Sometimes good old-fashioned incision and drainage is enough.
Oh, okay.
But if the infection is serious or if the patient has other health issues, then antibiotics are necessary.
Okay, but how do doctors choose the right one? There's so many.
It's a bit like being a detective. They use a combination of clues.
What kind of clues?
The type of surgery, the patient's medical history, even the appearance of the wound.
Okay.
And sometimes they'll take a sample and send it to a lab to identify the specific bacteria.
Like CSI for bacteria.
Exactly.
The source material also mentioned topical agents, like povidone iodine and hydrogen peroxide.
Right.
Are those helpful?
That's a good question and a common one.
Yeah.
While those agents can kill bacteria, they can also be harmful to healthy cells.
Wow.
And they can actually slow down wound healing.
Really?
So the current thinking is that drainage and debridement are more effective and they cause less damage.
So sometimes less is more.
Exactly.
When it comes to wound care.
Precisely. Now shifting gears again.
Okay.
Let's talk more about sutures and wound closure techniques.
All right. I'm all ears.
The source material has some great insights into how different techniques can impact healing and reduce complications like fascial dehiscence.
Okay, I'm always amazed by how much precision goes into closing a surgical wound.
It's not just slapping on a Band-Aid.
Right.
One of the key takeaways from the source material is the importance of minimizing tension on the incision line.
Minimizing tension.
When the tissues are pulled too tight, it puts stress on the sutures.
And increases the risk of them pulling through.
Exactly, leading to dehiscence.
So how do they avoid that?
Well, it starts with choosing the right type of suture.
Okay, what kind of sutures are there?
The source mentions slowly absorbable sutures.
Slowly absorbable.
They provide support for a longer period.
So the tissues have time to heal.
Exactly. And the technique used to place the sutures also matters.
Okay, so let's talk technique.
All right.
I'm curious about continuous sutures and interrupted sutures.
Okay, good question.
What's the difference?
Well, continuous sutures are one long suture that runs the entire length of the incision.
Okay.
They're faster to place, and they distribute tension more evenly.
Okay, and interrupted sutures.
Those are individual sutures placed one after another.
Oh, okay.
They can be helpful in certain situations.
Like what?
If the tissues are fragile,
Okay.
or if there's a lot of drainage.
So it's like choosing between a zipper and a row of buttons.
I like that analogy.
Each has its pros and cons.
Exactly.
And what about those heavy-duty sutures, the retention sutures? When are those used?
Those are like the reinforcements,
Okay.
typically used when there's a higher risk of fascial dehiscence.
Like with obesity?
Yes, obesity, radiation, or other health conditions that impair healing.
So they're like adding extra straps to a backpack?
Exactly, to distribute the weight more evenly.
One more thing about sutures. The source material said the length should be about 4 times the length of the incision.
That's right.
Wow, that's a lot of thread.
It's all about precision.
So surgeons don't just eyeball it.
No, they follow guidelines to make sure the wound is closed properly.
For the best chance of healing. It's amazing how much goes into surgery.
It is.
This is a combination of science and art.
It really is a delicate dance between skill and understanding the body's natural healing processes.
Speaking of healing processes, let's talk about post-operative care.
Okay.
Managing pain and promoting recovery.
Sounds good.
Okay, I'm ready to dive into pain management because, let's be honest.
Yes.
Nobody enjoys pain, especially after surgery.
Of course not.
And thankfully, pain management has come a long way.
It really has the old no pain, no gain idea doesn't apply here.
Right.
Effective pain management is essential for comfort.
Yeah.
But also for healing and preventing complications.
So how do doctors approach pain management now?
We use a multimodal approach,
Multimodal meaning.
combining different techniques to target pain from multiple angles.
Okay.
It might include medications, nerve blocks, physical therapy, even alternative therapies like acupuncture or massage.
So it's like a personalized pain management plan.
Exactly.
Tailored to each patient's needs.
Right, and it's not just about masking the pain.
Right.
It's about addressing the underlying causes.
Yeah.
And helping the body heal.
Okay. And that brings us to nutrition.
Absolutely.
What we eat affects our health.
Of course.
But how does that play into healing after abdominal surgery?
It's crucial. Think of your body as a construction zone after surgery.
Okay.
Tissues need repair. The immune system is working overtime.
Right.
Proper nutrition provides the building blocks for all that.
So what should people focus on eating?
Well, the source material doesn't give a specific meal plan,
Okay.
but it stresses protein.
Protein.
It's essential for cell growth and repair.
Got it. Protein is a priority.
It is.
But what about patients who have trouble eating after surgery?
Right, nausea, pain, those sorts of things.
Yeah.
We have a few options there.
Like what?
Nutritional supplements can help.
Okay.
They provide concentrated calories and nutrients.
Right.
And in some cases, intravenous feeding might be necessary.
Intravenous feeding.
It's not ideal, but
Yeah.
it makes sure the patient is getting what they need.
So it's like finding a detour
Exactly.
when the usual road is blocked.
You still get to your destination.
The body still gets what it needs.
Precisely. And speaking of navigating obstacles,
Yeah.
let's go back to the challenges of surgery for patients with morbid obesity.
Okay.
We talked about peniculectomy and specialized rechasters,
Right.
but there's another important factor for the surgeon's expertise.
Makes sense. You want someone experienced with these specific challenges.
Exactly. Surgeons who regularly operate on patients with morbid obesity.
Yeah.
They have a deep understanding of the anatomical variations and the potential complications.
So they're better equipped to handle those challenges.
Exactly. They can adjust their techniques and ultimately achieve the best outcomes.
So finding a surgeon with that specific expertise
It's very important.
can make a real difference.
Absolutely.
And speaking of finding the right expert,
Yes.
let's talk about radiation again.
Okay.
It can make surgery tricky.
It can.
And one of the most important
It's
things,
timing.
timing.
Ideally, surgery happens before radiation.
Right.
But if not,
Yeah.
it should be delayed for several weeks
The
after.
tissues recover.
Exactly.
So it's all about finding that balance
It is.
between treating the cancer and allowing the body to heal.
Right. And that's where those multidisciplinary teams are so important.
Yeah, they can assess the individual situation and make the best plan.
Exactly. Collaboration is key.
Yeah.
Working together to provide the best care.
And patients should advocate for themselves?
Absolutely.
Asking questions.
Yes.
Seeking second opinions if needed.
Exactly. Be an active participant in your healthcare.
And here's something to think about.
Okay.
Remember, pain in irradiated wounds.
Yes.
It might be a sign of ischemia that restricted blood flow.
Right.
It's a reminder that our bodies are always sending us signals.
They are.
Trying to tell us what's going on.
We just need to listen.
Pain isn't always something to just mask or ignore.
Right.
It can be a clue that something else is happening. It's like our bodies are speaking to us in a secret language.
A secret language.
And we need to learn to understand it.
That's a great way to put it.
So we've covered a lot today.
We have.
From hidden lakes of fluid.
Yes.
To the importance of timing surgery and radiation.
Right.
We've talked about the risks, the challenges, and the advancements in care.
We have.
And remember, knowledge is power.
It is.
The more you know about abdominal surgery, the better prepared you'll be to navigate this complex world.
Absolutely, whether for yourself or for a loved one.
And until next time.
Yes.
Deep divers, stay curious, stay informed, and keep asking those questions.
Those are the most important things.
And we'll be here to help you dive deep
into the fascinating world of knowledge.
See you next time.
See you then.
It's a delicate balancing act, figuring out the best timing when radiation is involved.
It is.
But, hey, that's why these surgeons are the experts, right?
Exactly. And it really highlights the importance of a multidisciplinary approach to care.
Multidisciplinary.
Yeah, the surgeon isn't making decisions alone.
Right.
They're working with oncologists, radiation therapists, all sorts of specialists.
Okay, so it's like a team of superheroes.
They like that analogy.
Each with their own unique powers, all coming together to fight for the patient's well-being.
That's a great way to put it. And speaking of teamwork.
Yes.
Let's circle back to something we talked about earlier, pain management after surgery.
Okay.
You know, no one enjoys pain.
Especially after something as major as abdominal surgery.
Of course not.
So how do doctors handle this post-op pain?
Well, thankfully, pain management is much more sophisticated than it used to be.
In what way?
We use what's called a multimodal approach to pain management these days.
Multimodal meaning?
It means combining different techniques to target pain from different angles.
So like a pain-fighting cocktail?
Precisely.
Okay, so what are some of the ingredients in this cocktail?
Well, it might include medications like opioids, NSAIDs, even nerve blocks.
Nerve blocks, those sound intense.
They can be very effective, especially for severe pain. And then you have non-medication approaches like physical therapy, which can help restore movement and function.
Right.
And then even alternative therapies like acupuncture or massage.
Wow, so many options.
It's all about addressing pain from multiple angles.
So it's not just about masking the pain.
No, it's about addressing the underlying causes and helping the body heal.
Right, and let's not forget about good old-fashioned nutrition.
Oh, absolutely. What we eat plays a huge role in how our bodies recover.
It's like giving your body the right building materials to repair and rebuild.
Exactly. You wouldn't try to construct a house with flimsy wood and weak nails.
Right.
Your body needs the right fuel to heal properly.
So what kind of fuel are we talking about after abdominal surgery?
Well, the source material doesn't give specific dietary recommendations.
Okay.
But it does emphasize protein.
Protein.
It's crucial for building and repairing tissues.
So make sure you're getting enough protein. Got it.
Exactly, whether through your diet or even supplements.
Okay, but what about patients who have difficulty eating after surgery?
Right, nausea, pain, those sorts of things can make it hard to get enough food down.
Exactly. So what happens then?
Well, in those cases, nutritional supplements might be necessary.
Okay.
Or even intravenous feeding in some situations.
Intravenous feeding?
Yeah, it's not the ideal scenario.
Right.
But it ensures that the patient is getting the calories and nutrients they need to heal properly.
So it's like finding a workaround, a detour on the road to recovery.
Exactly.
To make sure the body gets what it needs.
Precisely. And speaking of finding workarounds,
yes,
let's go back to those challenges of surgery for patients with morbid obesity.
Okay.
We talked about peniculectomy, but the source material mentioned a couple of other techniques that surgeons use.
Like what?
Well, one is using specialized retractors.
Specialized retractors?
They're kind of like surgical clamps.
Okay.
And they help to lift and hold the peniculus out of the way during the procedure.
So it's like creating more space for the surgeon to work.
Exactly. It's all about creating the best possible working conditions, even when faced with challenging anatomy.
Right, and that probably reduces the risk of complications too.
Absolutely. And it highlights the importance of choosing a surgeon who has experience operating on obese patients.
Yeah, it's like any other specialized fields, you want someone who knows what they're doing.
Precisely, someone who's familiar with the specific challenges and how to address them.
Exactly. And speaking of specialists,
Yes.
let's shift gears back to radiation and its impact on abdominal surgery.
Okay. As we discussed, radiation can have a significant effect on wound healing.
Right. It's like a double-edged sword.
It is a powerful tool for treating cancer, but it can also make surgery more complex.
And one of the key takeaways from the source material
Is the importance of timing?
timing when it comes to surgery and radiation.
Exactly. Ideally, surgery would be performed before radiation even begins.
Right, when the tissues are still healthy and strong.
Exactly, but sometimes that's just not possible.
Right.
So if surgery has to happen after radiation, it's crucial to allow those tissues enough time to recover.
How much time are we talking about?
The source material suggests waiting several weeks after radiation is complete.
Several weeks. Wow.
Before going in with the scalpel rushing, things could significantly increase the risk of complications.
So it's a delicate dance
It is.
between treating the cancer effectively and minimizing the impact on surgical outcomes.
Exactly. And that's why those multidisciplinary teams we talked about are so crucial.
Right.
Surgeons, oncologists, radiation therapists, all working together.
To figure out the best course of action for each patient.
Exactly. It's all about collaboration and shared decision-making.
And making sure the patient is at the center of it all.
Absolutely. Their needs and goals should guide every decision.
Speaking of patient needs,
Yes.
I wanted to touch on something the source material mentioned about pain in irradiated wounds.
Okay.
You'd think pain would be a given in that situation.
You would.
But the source suggests it might be more than just post-surgical discomfort.
It does, and it mentions that this pain could actually be a sign of something called ischemia.
Remind me what that is again.
Ischemia basically means restricted blood flow.
Okay. Restricted blood flow.
So the pain in an irradiated wound might be a signal that the tissues aren't getting enough oxygen and nutrients.
Because the blood vessels have been damaged by the radiation.
Exactly. It's fascinating, isn't it?
It is. It's like our bodies are sending us these coded messages.
They are.
And we need to learn how to decipher them.
And speaking of deciphering messages,
Yes.
let's go back to surgical site infections for a moment.
Okay.
The source material goes into some detail about the different types of antibiotics used to treat them.
Yeah, antibiotics, the big guns.
They can be, but it's important to understand that not all wound infections require antibiotics.
Really?
Sometimes simple incision and drainage is enough to clear things up.
Interesting.
But if the infection is more serious, or if the patient has other health issues that make them more vulnerable,
Right.
then antibiotics are definitely necessary.
So how do doctors choose the right antibiotic when they are necessary?
Well, it's a bit like being a detective.
Okay.
We use a combination of clues to figure out which antibiotic is most likely to be effective.
What kind of clues?
We consider the type of surgery, the patient's medical history, even the appearance of the wound itself.
Okay.
And sometimes we'll take a sample of the wound and send it to a lab for testing.
To identify the specific bacteria causing the infection.
Exactly. It's like CSI for bacteria.
The source material also mentioned topical agents like povidone iodine and hydrogen peroxide.
Right, those are common questions.
Yeah. Are those helpful in treating wound infections?
That's a great question, and one that often causes confusion.
Yeah.
While these agents can kill bacteria, they can also be harmful to healthy cells.
Oh, so they can actually slow down wound healing.
That's right. So the current thinking is that drainage and debridement are more effective than topical antiseptics.
Interesting.
And they're less likely to cause further damage.
So sometimes less is more.
Exactly, especially when it comes to wound care.
Now let's dive a little deeper into the world of sutures and wound closure techniques.
Okay, sounds good.
The source material gives some great insights into how different techniques can impact healing
It does.
and reduce the risk of complications like that fascial dehiscence we talked about.
Right, it's not as simple as just closing the wound any which way.
I'm always amazed by how much thought and precision goes into it.
It's a crucial part of the surgery.
So what are some of the key takeaways about sutures and wound closure?
Well, one of the most important things is to minimize tension on that incision line.
Minimizing tension.
Exactly, because when the tissues are pulled too tight, it puts stress on the sutures.
Right, and that increases the risk of those sutures pulling through the tissue.
Exactly, which can lead to dehiscence. So it's all about finding that balance, closing the wound securely, but without creating too much tension.
How do surgeons find that balance?
Well, it starts with choosing the right type of suture.
Okay, what types of sutures are there?
Well, the source material mentions that slowly absorbable sutures are often preferred for abdominal surgery.
Slowly absorbable so they break down over time.
Exactly. They provide support for a longer period, allowing the tissues to heal properly.
And the technique used to place the sutures also matters.
Absolutely.
I'm curious about those different techniques. The Vorse material mentioned continuous sutures and interrupted sutures. What's the difference?
Great question. Continuous sutures are one long suture that runs the entire length of the incision.
Oh, okay, like a zipper.
Exactly. They're often preferred because they're faster to place and they distribute tension more evenly along the incision.
Okay, makes sense. What about interrupted sutures?
Those are individual sutures placed one after another.
Okay, so like a row of buttons.
Exactly. They can be helpful in certain situations, like if the tissues are particularly fragile or if there's a lot of drainage.
So each technique has its pros and cons.
Exactly. And the surgeon will choose the best approach based on the specific situation.
What about those heavy-duty retention sutures we talked about earlier? What are those used?
Those are like the reinforcements, remember?
Right.
They're typically used in situations where there's a higher risk of fascial dehiscence,
Okay.
like in patients who are obese or have had radiation or have other health conditions that might impair healing.
So they provide extra support.
Exactly. They're placed further away from the incision line through all layers of the abdominal wall, and they take some of the strain off that primary suture line.
So it's like adding extra straps to a backpack to distribute the weight more evenly.
A perfect analogy.
And one more thing about sutures. The source material mentioned that the length of the suture should be about 4 times the length of the incision.
That's right. It's a lot of thread.
It is. So surgeons don't just eyeball it.
No, they follow specific guidelines to make sure the wound is closed properly.
To give it the best chance of healing without complications.
Exactly. It's all about precision.
It's fascinating how much science and artistry go into surgery.
It really is a delicate balance of technical skill and understanding the body's natural healing processes.
And speaking of those healing processes,
Yes.
let's move on to another crucial aspect of postoperative care, managing pain and promoting optimal recovery.
Okay. I'm ready to delve into the world of pain management.
It's a world that's evolved a lot in recent years.
Oh, so?
Well, the old adage of no pain, no gain definitely doesn't apply here.
Right.
We now understand that effective pain management is essential not only for patient comfort, but also for promoting healing and preventing complications.
So how do doctors approach pain management after abdominal surgery these days?
We use what's called a multimodal approach, which basically means combining different pain management techniques.
So it's not just about popping pain pills.
It's much more nuanced than that. It might include medications like you mentioned, but also nerve blocks, physical therapy, even alternative therapies like acupuncture or massage.
So it's like a personalized pain management cocktail.
Exactly. Each ingredient plays a specific role in relieving pain and helping the body heal. And that's the ultimate goal, right?
It is. We want to help patients recover comfortably and get back to their lives as quickly and safely as possible.
It's amazing how much has changed in pain management. The focus now is really on helping patients recover comfortably and effectively. And speaking of recovery, let's talk about another important piece of the puzzle, nutrition.
Absolutely.
I mean, we all know what we eat affects our health.
Of course.
But how does that play into healing after abdominal surgery?
It's absolutely crucial. Think of it this way. Your body has just undergone a major event.
Yeah.
It's like a construction zone in there. Tissues needing repair, the immune system working overtime. Proper nutrition provides the building blocks for all of that.
Okay, so what kind of dietary building blocks should people focus on after abdominal surgery?
Well, while the source material doesn't give us like a specific meal plan,
Right.
it does stress the importance of protein.
Protein.
Makes sense. Protein is essential for cell growth and repair. So making sure you're getting enough is key for bouncing back after surgery.
Got it. Protein is a priority.
Right.
But what about those patients who struggle to eat after surgery?
Right.
You know, maybe they're dealing with nausea pain or other complications that make it tough to keep food down. What options are there for them?
That's a common challenge, and thankfully surgeons have a few tools to address it.
Okay.
Nutritional supplements can be a big help, providing concentrated calories and nutrients in an easy-to-consume form.
Right.
And in some cases, intravenous feeding might be necessary.
Intravenous feeding.
Yeah, it's not ideal, but it ensures the patient is getting the vital nourishment they need while their digestive system recovers.
So it's like finding a detour when there's construction blocking your usual route.
Exactly.
You still get to your destination just by a different path.
You got it. And speaking of navigating obstacles, let's circle back to the challenges of surgery for patients with morbid obesity.
Okay.
We've already talked about paniculectomy and specialized retractors, but there's another important aspect to consider: the surgeon's expertise.
That makes sense. It's like any specialized field. You want someone who's experienced and skilled in the specific challenges involved.
Precisely. Surgeons who regularly operate on patients with morbid obesity develop a deep understanding of the anatomical variations and potential complications that can arise.
Okay.
They're better equipped to anticipate challenges, adjust their techniques, and ultimately achieve the best possible outcomes for their patients.
So if you're facing abdominal surgery and you're dealing with obesity, it's definitely worth seeking out a surgeon with specific expertise in that area. It could make a real difference in your recovery and long-term health.
Couldn't agree more. And while we're on the topic of finding the right expert, let's revisit the impact of radiation on abdominal surgery. Remember, radiation can be a lifesaver for cancer treatment,
Right.
but it can also make surgery trickier.
It's like a double-edged sword, incredibly powerful, but with the potential for unintended consequences.
Exactly, and one of the most important things to remember is that timing is everything when it comes to radiation and surgery. Ideally, surgery would happen before radiation treatment begins when the tissues are still healthy and strong.
But, as we've discussed, that's not always possible.
Mm-hmm.
Sometimes the surgery needs to happen after radiation. So what's the best approach in those situations?
If surgery has to happen after radiation, the key is to allow enough time for the tissues to recover. Rushing into surgery too soon after radiation can significantly increase the risk of complications.
So it's all about finding that sweet spot, balancing the need for surgery with the need to allow the body to heal from the effects of radiation. And that's where those multidisciplinary teams really come into play, right?
Hmm.
They can assess each patient's individual situation and come up with the safest and most effective plan.
Absolutely. It's a collaborative effort with experts from different fields coming together to provide the best possible care.
And speaking of experts providing care, I'm curious about something that might seem obvious, but it's worth emphasizing the importance of advocating for yourself. Asking questions, seeking second opinions if needed, and really being an active participant in your healthcare decisions.
That's such a crucial point. The more you know about your conditions, your treatment options, and the potential risks and benefits, the better equipped you'll be to make informed choices and advocate for your needs.
And here's a final thought to ponder, inspired by something we discussed earlier. Remember how pain in irradiated wounds might actually be a sign of ischemia, that restricted blood flow. It's a reminder that our bodies are constantly sending us signals, trying to communicate what's going on beneath the surface.
That's a brilliant observation. Pain isn't always just something to be masked or ignored. It can be a valuable piece of information, a clue that something deeper is happening.
So true. It's like our bodies are speaking to us in a secret language, and it's up to us, along with our healthcare providers, to listen carefully and decipher those messages.
And that, I think, is the perfect note to end on.
I agree. We've covered a lot of ground today, from those hidden lakes of fluid to the delicate dance of timing surgery and radiation. We've explored the challenges, the risks, and the incredible advancements in surgical techniques and care. But most importantly, we've learned that knowledge is power. The more you understand about abdominal surgery and its potential complications, the better prepared you'll be to navigate this complex terrain, whether for yourself or for a loved one.
Well said. And until next time, deep divers, stay curious, stay informed, and keep asking those important questions.
And as always, we'll be here to help you dive deep into the fascinating world of knowledge